Hi, and welcome to another of Hendrik's high-yield pediatric topics. I got my first request after 12 people watched my video. Somebody sent in a request that I do a quick video on developmental milestones. So I'm going to focus briefly on growth and development. So starting with growth. As you know, an infant can lose some weight after they're born. We expect them to lose a little bit of weight, no more than 10% of their birth weight, and we expect them to regain that birth weight by 2 weeks of age. We expect infants to double their birth weight by 4 to 6 months of age and triple their birth weight by 1 year of age. For height, we expect them to double their height by about 4 years of age, so doubling their weight by about 4 to 6 months, doubling their height by about 4 years, and then tripling their height by about 13 years of age. Now we're going to move quickly into developmental milestones, and I'm going to simplify the developmental milestones as much as possible to the things that you really need to focus on for step 2 of the board exams, as well as for your pediatric rotations. So what are some big red flags? When we think of developmental milestones, and these are the milestones that we're checking at every well-child visit, and they give us a good indication of if we need to evaluate the patient further for developmental delay or start getting them some support services, physical therapy, speech therapy, hearing evaluation, things like that. You can break the developmental milestones into 4 or 5 categories. For the purposes of this talk, I'm just going to focus on 4 categories. So we're going to focus on language, gross motor, fine motor, and then social and cognitive. So let's start with language. Starting with language, we expect a 2-month-old baby, that's usually where the milestones start at 2 months of age. We expect a 2-month-old baby to be able to coo. Cooing is making the vowel sounds, oohs and ahs. We expect them to start babbling. Babbling is using the consonant sounds, da 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 da, ma 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 ma. We expect them to start babbling at about 6 months of age. In general, people develop from top to bottom and from inside out. So what exactly does that mean? That means that as they're starting to develop their motor skills in their mouth, they're going to say consonant sounds that start with their tongue in the back of the mouth first. So da da da, they're probably going to say it a lot sooner than ma 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 or pa pa pa. So if a mother comes in and she's upset that the baby is saying dada a whole lot more frequently or much earlier than they say mama, it's just normal development. It means nothing about the baby's preference in their parent. So 2 months they're cooing, oohs and ahs. 6 months they're babbling. We expect them to say their first word around 9 months of age. So that's when they're distinctly saying a word, dada, mama. My daughter's first word was cat. By 1 year of age, we expect them to have anywhere from 4 to 10 words. And at this point, they're saying them to specific items, so they know what the words mean. Initially, when a child starts talking, they may call everything dada, 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 dada. And then by the time they're 1 year, we expect them to really associate the word dada with whoever they're calling dada. Then we move to 2 years of age. At 2 years of age, we expect the child to have at least 50 words and be putting 2 words together in a sentence. My shoes, take their, things like that. So they're putting the words together in 2-word sentences. At 3 years of age, we expect them to have over 100-word vocabulary and to be able to put at least 3 words together in a 3-word sentence. So 2 years, 2-word sentence, 3 years, a 3-word sentence. By the time they're 4, we expect them to be fully understandable, right? So 100% understandable. And when I say that, I mean by a stranger. So when I'm asking a parent, I'll say, if your child were to start talking to me, somebody that doesn't know their language, how much of her speech would I be able to understand? I have a memory tool for this, and that is if you take the child's age over the number 4, that's the percent understandable that we expect in a normally developing child. So at 1 year, we expect them to be about 25% understandable, 1 over 4. 2 years, about 50% understandable. 3 years, 75% understandable. And at 4 years, speaking in full sentences, 100% understandable to others. So that's language. Gross motor. For gross motor, so remember, they're developing from top bottom and from inside out. So from top bottom with gross motor, at 2 months, we expect if you lie the baby flat with their face down, we expect them to be able to lift their head up about 45 degrees. By 4 months, we expect that to lift up by about 90 degrees. We also expect them to start rolling over one direction at 4 months. Usually they roll over from front to back first. It's easier if you can imagine a baby laying down on their tummy. It's easier because they can use their arms as leverage to get them to roll over onto their back. By the time they're 6 months, we expect them to roll both directions, front to back and back to front. Also at 6 months, we're expecting them to be able to sit up by themselves. At 9 months, we're expecting them to be able to crawl. Not all babies crawl. They may start cruising at this point too. Cruising is when a child is standing up and is able to walk holding on to furniture, so with the assistance of furniture. That's called cruising. By 1 year, we expect them to take their first step or two. We expect them to be able to walk while holding a parent's fingers or parent's hand. By 18 months, we expect them to be able to walk really well. By 2 years, we expect them to be able to run well. And then by 3 years, we're expecting them to be able to walk up and down stairs without support. And then by 5 years, they can skip. So think about 5 going to kindergarten, they can skip to school. Okay, so for gross motor, first they're lifting their head up just a little bit at 2 months, then 90 degrees at 4 months, rolling front to back. 6 months, they're rolling both directions and able to sit by themselves without falling over. 9 months, they're able to crawl, maybe start to be able to cruise. At 1 year, starting to take their first couple of steps, walking with assistance. 18 months, they're walking well. 2 years, they're running well. 3 years, they're going up and down stairs. And 5 years, they are skipping to school. So now we're going to move to fine motor. So fine motor are usually dexterity, things that we think about with the hands and the fingers. First, with fine motor, we're just thinking about their eye movement. So at 2 months, we expect them to be able to follow somebody to about midline, right? So from over to the side to about midline. By 4 months, they can go past midline, so they'll actually watch somebody as they walk across the room. At 6 months, so remember, we're developing from inward, outward, right? So at 6 months, we expect them to be able to have a raking grasp. So they're bringing their hand in this direction to kind of scoop something up. By 9 months, they'll have non-specific pincher grasps, so they may use more than just 2 fingers to be able to pick something up. By 1 year, we expect them to have that really fine pincher grasp, just with a thumb and a forefinger, to be able to pick something up and put it in their mouth. At 1 year, they can also start stacking a couple of blocks. By 3 years, they can make a tower of 9 blocks and they can start drawing. So now we move into more of the drawing or writing for the fine motor milestones. The mnemonic that I have for the drawing or writing is it generally goes in alphabetical order, starting with circle. So at 3 years, they can do a circle. Then they move on to being able to do a cross at 4 years. At 4.5, they can do a square. And then at 5, they can do a triangle. And then the last thing they can do is a diamond, which doesn't fall into my alphabetical mnemonic, right, of circle, cross, square, triangle. But as Dr. Maloof likes to say, if you think of it as a zirconium, that diamond shape, that's the last thing that they're usually able to do. And then drawing people at age 6 as well. Okay, so we have done language, we've done gross motor, we've done fine motor, and now we're going to move into that 4th category, which is the social cognitive. At 2 months of age, and this is a very important time for the parents, 2 months we expect the child to be able to have a social smile. So this means they're not just smiling spontaneously with gas or a funny little feeling they have or in their sleep. This means you look at the infant and you smile at them and they smile back at you. It is a fantastically rewarding time for parents who have put in so many sleepless nights for that little baby up until that point. They start smiling back at you is wonderful. At 4 months, we expect them to start laughing, to be able to localize to sound, so they'll turn their head to a sound. By 9 months, they will start to develop some separation anxiety. 9 months is usually the time as a pediatrician when the exams get a little bit more challenging because the infant is starting to recognize that you are not one of their caretakers, and so they may develop a little bit of stranger anxiety as well. At 12 months, we continue with the separation anxiety. At 18 months, they can do parallel play. So you bring 2 18-month-old children together and they'll play right next to each other without necessarily playing together. At 2 years, they can start dressing themselves with some help. They may be able to undress themselves faster than they can put on clothes without help. At 3 years, they develop that magical thinking, so they'll be able to start playing with things, making up imaginary stories, really playing with different toys, acting out different scenes. At 4 years, we expect them to play really well with others. That should come pretty easily. And then at 6 years is when we expect them to be able to distinguish that fantasy from reality. So that was a rapid fire walkthrough of the developmental milestones. Hopefully this is helpful. Like I said, I try to focus on the most high yield information, so I tried to really pare it down for you. Please keep giving me feedback, and if you have any requests, please give them to me. Thanks so much. Have a great day.